Hey, this is Shirley Gutkowski at Primal Air, and we are going to be talking today with Dr. Shalom Samuels of Shalom Family Chiropractic. I almost said dentistry again. So that's just how it goes, I guess, some days. And so what we wanted to talk about today was the curve of the neck, which I think gets very little talking, very little explanation or anything like that. So could you kind of go through a little bit what it is and why it's important?
So when we're born, we kind of don't have any curve, but the reason we do those belly exercises with the kiddos when they're babies is to accentuate that curve. So you should have a nice, almost C-shaped curve that creates that S curve when you look at it from the side on an adult. But the very first is when we're accentuating and trying to get that curve going on babies when they have tummy time, whether they like it or not. Mostly they like it, but if there's something impinging that side or they had a traumatic birth, well, they're not gonna like it. So that's another reason we always talk about babies getting checked right away, because birth being the first trauma. And then we learn to bike, we bump our heads, fall on our butts. Then we play football, tennis, being active in sports. As an adult, you should have a nice C-shaped curve, but do we all? Not really, because we've been in car accidents, we've had head traumas, and then you add technology. We're on our phone all the time, so our heads are not on top of our shoulders, but way forward, and that creates that straight neck. Whiplash injuries also create that straight neck. So when you're straight, you have much more tension on your nerves than when you're curved, so that you have more room for the nerves to exit out of the sides of your spine.
Right. So so I'm working with the soft tissue and you're kind of working with the bone mostly. And so how does that go together? If you have a curve that curves into the front, right? It doesn't curve back out
Backwards,
the other way. Right. So it curves towards your front. So wouldn't that interfere with your airway? Wouldn't that kind of close it off?
Yes. And then the muscles are pulled along with it too. So let's say you had a whiplash injury where you went forward and back. So all those muscles are going to be tense. So that's why most people, it hurts to swallow. It hurts to move the neck in any direction. Because you've had such bad trauma to your cervical spine and the muscles and the nerves and the ligaments and the blood vessels, everything that goes with it. So the muscles get tight. So the more forward you are, you also lose your center of gravity too, right? So you have muscles in the back and muscles in the front. So you're not exercising the muscles in the front when you're too forward, but stretching out the muscles in the back to the extreme. When you're on the right posture, then you're exercising both sides. That's that teeter-totter balance, right? So when one set of muscles are exercising, the other one should be relaxed, and vice versa. So when we don't have that teeter-totter in balance, then havoc happens in your spine and the rest of your health. You can get headaches, you can get migraines, changes in vision, ringing in the ears, trouble swallowing, your bite might not be right, which you know better. And yeah, all the muscles are going to be sore. And once you start pushing, this week especially, I've seen a lot more temporomandibular TMJ issues. They don't say, hey, I have issues. But when I work on their skull, in the cranial bone, they feel the tenderness over here. So I know they have TMJ issues and other issues because that muscle there is so tight.
Why wouldn't it hurt then? I think you did that for me. So, I had an adjustment last week and you were like poking right here. And you're like, wow, that's really tight. And I'm like, no, it isn't. It hurts. But it was way
Yeah.
up here. My jaw joint is here, and you were pressing here. So the
Mm-hmm.
muscles were out of whack somehow. So
Your temporalis muscle. This is the temporalis muscle, and so the bite. So when you're chewing food, this is working, and it also attaches to the TMJ. And so for some reason, whether it was slept wrong, broke your leg and walking wrong, that kind of thing, it has an effect. Like I talked about before, even whatever happens to your feet are your foundation. So whatever happens there, trauma, accident, anything like that, has the repercussions of that trauma down there, has an effect on your TMJ, and therefore all the muscles that connect to the TMJ.
well, I did break my leg on that side just recently. So I wonder if, right away, I was even laying there. I'm like, boy, and I need a chiropractor like right now. And then when I found out my leg was broken, I was like, well, I probably have to wait until that settles down a little bit. The ice is treacherous. It's April right now in Wisconsin. We had snow 3 days ago.
Yep.
But the ice is pretty much gone. In winter again, though, we're going to have another ice problem, and people are going to fall, and they're going to need to see a chiropractor like that day. I think that's how I've been doing it.
Mm-hmm.
Not that I fall a lot, but the last 2 times that I did, that were in the last 5 years, I think I may have slipped on the ice twice, not including this time. But that was a high priority. But I do want to get kind of back to this cervical curve, because when we're looking in people's mouths, whether they're laying down in a clinical situation for a dental appointment or a dental hygiene appointment, or if they're sitting upright and in a myofunctional therapy kind of situation, we look in their mouth and we're looking to see if we can see their airway. We want to see the whole uvula. We want to see whether or not we can tell that they have tonsils and that the tongue isn't like way up interfering with the airway.
Mm-hmm.
So if the curve is off, I think it's all of the muscles don't know how to situate themselves.
Right,
So if
right.
your head is forward, you're technically opening the airway, but it's not even a band-aid. It's a, what do you even want to call it? I mean, it's not,
Compensation technique,
yeah, it's
in a
not
way, I
good.
guess. No.
Yeah.
And even we're talking about what I learned from you is like, if you haven't trained your tongue to sit at the top of the roof of your mouth, then you just have all this tissue blocking the airway, you know? And then you add things like small jaw or TMJ issue or bite is wrong, all these different oral cavity issues on top of the issue of the tongue not staying in the top of your roof, then that's like double whammy, I guess, like multiple things working against you, and therefore you're not able to breathe.
So that's why it's really important to work together. You have to, training the muscles to work appropriately is what we help you do with myofunctional therapy. And what you do is you create a situation where the bone knows where it's supposed to go. And so those things need to work in concert. But sometimes you need to also have some kind of a different kind of a soft tissue intervention, a manipulation. So myofascial therapy, which
Mm-hmm.
is working with the fascia, which is not myofascial, which is what we
Correct.
do. And there seems to be a lot of confusion between the two. And
Mm-hmm.
then what other kind
Cranium.
of massage therapy things do you know the names of all of them?
Well, correction. Correction would
Okay,
be first, spinal correction, and
right.
then doing with the muscles. I do some myofascial therapy, but not in like an in-depth situation. And then also cranial bones, cranial adjusting too, because all of it, our TMJ is our connection to our skull, and so all of it will be tense as well. And then you add teeth grinding and other, emotion, and then you add emotional aspect to it. It's just not physical anymore when we look at our whole health. It's emotional, and all of it is connected, like we talk about whole body connection. So we have to look at it in every aspect. No matter how much I adjust, if their teeth is not right, their TMJ is going to be out the minute they walk out the door. So you need a good dental professional to be able to work with them in that way as well. And then if they're not in a good mental state and they don't believe they're going to heal, well, that's another trigger to not hold your adjustment. So we look at it in different aspects. And now I've added airway too, like to see in their mouth and see if I can see breathing airway. If I can't, well, then there's a referral to you, because again, if one is working well and the other's not, it's not functionally, it's not working for the benefit of the patient or their body.
I've been getting a lot of CT scans of our patients who complain of snoring, and a lot of them have a straight up cervical curve, straight up and down.
Military neck,
Or
yep.
it's just not right. Like there's no space between the bones or something like that. So all of those things need to kind of work together. If you're snoring, you're not healthy. That's a symptom of disease. And the disease may be that your muscles in here are inflamed from sitting over a computer all day. And then foreshortening your chest muscles by having your shoulders pulled in. So all of those things together, you need to kind of work on together to get that little piece out of there. Even if you stop snoring, your blood levels can be better in all different kinds of measurements because you're oxygenating appropriately. You're not abusing your airway muscles all night long. I have one patient who had sent me an x-ray just last week, and his soft palate is the thickest I've ever seen on an x-ray. It's just really thick. And
Wow.
so I asked him to talk with his ENT about that. I mean, I can't do everything, even though I sound like I do. It's we all have our little narrow airway or our little narrow professions to kind of stick with. We have to be able to smooth the edges or fray the edges so that we can overlap easier and realize that there's more to all of this than just this or this or that or that. So
and to have the freedom to say, hey, I can't help you with this. I'd like you to go see Shirley or a dentist or a massage therapist, because ultimately we're there to help them feel their best. So there shouldn't be any issues referring to each other.
Right. I don't think so either. And patients need to be ready for that. When I first started Primal Air, I was like, oh my gosh, I'm referring everybody out because they needed a tongue tie release or they needed some other kind of a something. They needed maybe arch expansion. I'm like, I'm never going to make my ends meet if I keep referring out.
Right.
But patients need to understand that we all need to work together. Otherwise, they're never going to get the results that they're expecting. And just because I send them to you for chiropractic care or you send them to me to get their muscles aligned so that their airway is more open, or we send them to a dentist for arch expansion, we all still need to work together. And it's not just one or the other of us. It's not like they came to you and they came to the wrong practitioner, or they came to me and they came to the wrong practitioner because I'm saying you need a chiropractor. So all of that stuff is real, and it takes a lot to keep up on the science and what's going on.
Right. And it changes every day, it seems like.
Oh my gosh. I know. So
Yeah.
we have to communicate and we need to say, well, look at this paper. How does that fit in? And I heard so-and-so's doing this other thing. How does that fit in? So the communication piece is also really important. So anyway, we're going on to like 15 minutes here. So
Okay.
I think that's maybe a little bit long enough. What do you think? Was there something else you wanted to mention?
No, I think we're good.
All right. So you have a Facebook page as well, and that is Dr. Shalom Family Chiropractic.
Shalom Family Chiropractic.
Oh, there we go. Shalom. I don't know. I do a lot of things, and then something like that just doesn't want to work for me. So
All right.
I'll just leave you say it from now on. And then we're
Yep.
at Primal Air. We're not very far apart from one another. I think your office right now is like 5 minutes from our office, maybe
Mhm.
8. And it might be even closer as we move along through this, through the summer. So
Mhm.
Shalom, thank you so much for joining me on this little Facebook Live. And let's try to do it in another week or two.
Yeah, sounds good. Thanks for having me.